Welcome everyone. Today we're so proud to be partnering with Kaiser Permanente. This is our second installment of our mental health series. If you weren't available for the last one, you can hop onto our website. It's available for replay. But today we're going to be talking about the important topic of mental health in minority communities. So we're really excited to get this conversation going. So I'm going to hand it over to Danielle.
Thanks so much, Monica. Hi, my name is Danielle and I am the public affairs representative here at Kaiser Permanente West LA. And I'm so excited because we get to do these kind of events very frequently with the chamber, and they're events that really range on a variety of topics. But because we have something that's so specific today, I think we're providing a great deal of information on something that really helps a lot of people. So if you have any questions on anything that pertains to an area that we're going over today, please drop it in the chat. If you're like, I'd rather that be something that not everybody hears my question or my thought, you can definitely just message it to me directly and I can ask it anonymously for you. But I'm really excited because we've got 4 of our really well-esteemed mental health, mental wellness experts on the line. And the way I want to do this is really have them give you a brief intro about themselves and what they do. But the part that they don't know is after they tell you who they are, what they specialize in, or what their background is, I really want them to give you guys the idea or the thing that makes them happy, that brings them joy, or that they're finding the most relaxing at this moment. So Chidi, Abha, Rojelio, Melvin, when you guys give your intro, that part definitely go and tell us, what makes you happy right now, okay? So with that, let's start with Chidi. Chidi, can you give us a little bit about yourself?
Yes, good morning, everyone, or afternoon, I should say. My name is Chidi Njoku, as Danielle stated. I'm the current Director for Psychiatry and Addiction Medicine here in the South Bay area. In Kaiser Permanente. I have been working in the field for, I've been working in the field since 1997. Worked in a host of positions since coming into Kaiser about 16 years ago now. I've worked in addiction medicine, both as a therapist as well as an administrator, psychiatry the same way, or as a clinician as well as an administrator. I've also worked in medical social work as well, in a host of different roles. So like I said, currently as an administrator and really enjoying that task and the responsibilities associated with that. Let's see, what brings me joy currently? On a day in, day out basis, spending time with my family, going on walks with my dog, and recreationally, I like to get out and play a little golf. And that's kind of one of the few activities that hasn't been disrupted too much with the pandemic. So that's me.
Thank you, Chidi. All right, no particular order, just go on with who I see on my screen here. Abha, let's jump to you. Tell us a bit about you and what's making you happy right now.
Yeah, hi, I'm Abha Verma. So I was born and raised in Southern California to South Asian immigrant parents. I went to UCLA for my master's in social work. Since then, I've been working as a therapist in different settings. So previous to Kaiser, I was in private practice. I was also at a nonprofit setting, focusing on trauma, sexual assault, domestic violence work. And then I've been at Kaiser for the last 7 years, working as a psychiatric social worker and providing mostly individual and group therapy. And I would say what's bringing me joy right now, my kids. I have 2 little ones, so it's definitely fun to be hanging out with them a little bit more than usual. And I would also say drawing. I've really gotten into drawing since COVID has started, and it's been a really great experience.
Thank you so much. All righty, Rojelio, let's go to you. Same thing. And don't forget, you've got to tell us what makes you happy right now.
Thank you so much. My name is Rojelio Olmedo. I'm a licensed marriage and family therapist, and I've been working for Kaiser Permanente for almost 10 years. I started back in 2011. Before Kaiser and during my tenureship here at Kaiser, I've also held different roles. I worked in addiction medicine, and also the Department of Psychiatry. And I've also taught at a local university, graduate students that were studying to be therapists. Some of the things that make me happy right now are outdoors activities. One of the things that Chidi said that really resonated with me is some of these outdoor activities weren't really impacted. So I continuously ride my bike, I take hikes, I've gone camping. You know, doing this with my friends and my family and my loved ones is something that keeps me happy and keeps me going on a day-to-day. So thank you.
That's perfect. All righty. And Melvin, last but equally important, I'm throwing it to you. Tell us about you, and let's go with what's bringing you joy also.
Hey, my name is Melvin Mercer. I'm a native Southern California, born and raised in Pasadena, California. I have a bachelor's degree from Howard University in Washington, D.C. Became a licensed clinical therapist in Maryland. I graduated from the University of Maryland School of Social Work. I've been with Kaiser now a little under a year and a half. Prior to coming to Kaiser, I was with the LADMH, Department of Mental Health, Los Angeles, and various community organizations. I've been doing in this field probably about 11 years, on and off, doing individual and group therapy. Something that brings me joy right now is being fully vaccinated. My family's been fully vaccinated, with the exception of my 11-year-old twin boys. So that's something that's bringing me joy. They're spending a lot of time with them. Being a father, being a husband brings me joy, and just yeah, those are things that bring me joy. I spend a lot of time with my boys. So
That's so good. Thank you so much, everybody. So as you guys know, this is being recorded, so it's also going to be able to be replayed later. However, what we're going to be doing right now is I'm going to actually send it over to Chidi. Chidi has some really in-depth questions that he's going to be tossing to our panelists, and I'm really excited to get into them. So with that, Chidi, let me hand it over to you, and we can get this started.
Sounds good. Thanks so much, Danielle. So we're just going to go ahead and dive on in. Melvin, we're going to go ahead and start off with you, my friend. So a question I want to throw your way is, with everything that's been going on over the course of the last year, we've had COVID-19, we've had a host of racial and social injustices that have been highlighted in the news and all around this. I'm curious for your take on this. How would you say the social climate in America over the course of these last year, actually year and a half, have been affecting persons of color?
Yeah, thank you for your question. I would say it's I've seen a lot of patients. I'm one of the few African American male therapists here in West LA. So a lot of my clients, I have a large client base. They want to see me specifically for the fact that I'm an African American male, and they believe I can provide a culturally competent perspective to their needs. So what I'm seeing is that a lot of trauma. A lot of African Americans that come to me are talking about a lot of trauma, a lot of PTSD, um, interactions with the police, seeing it daily on the news. We had the George Floyd incident that was, a national event that my clients really identify with. So interactions with the police, living in the inner city, living in Los Angeles, a lot of my patients come in contact with the police, and they talk about that. So they bring their thoughts and these events to session with me often, and it's, am I next? This happened to my cousin. I was pulled over with the police and I couldn't stop panicking, different things of that nature. So that's what I'm seeing a lot with my patients. And when I look at the research, I was doing some research when I was asked to participate on this panel, and I saw some research that talked about with policeviolence.org. They talked about that Black Americans make up 13% of the population in the United States, but they're 35% of the individuals that are being killed by police, and 36% of individuals that are killed by police being unarmed, they're African Americans. So I'm seeing the cousins of the victims of police brutality. I'm seeing the grandparents, I'm seeing the parents. And so that's what I'm experiencing in my day-to-day sessions that I provide with my patients, is that they're really being affected by this, and seeing it daily on the news is really, really, really creating some trauma for them. So that's what I've noticed in the racial climate. You throw in COVID, and that's just another added stressor, but specifically with police violence and the racial justice in America.
Okay, thank you so much for that, Melvin. And Rojelio, I'm gonna come over your way. And so I guess my question, Melvin did a great job of kind of articulating how just the way the environment has been impacting people of color and driving them to want to seek out services and what have you. And I guess my question for you is more related to, the barriers that people of color have to overcome in seeking mental health services. So could you speak to that a little bit?
Right. Thank you. Thank you for the question. There's quite a number of barriers that impact communities of color in seeking mental health. I think some of the important ones that maybe people are aware of are cost, right? Some people, unfortunately, are uninsured or underinsured, and seeking mental health out in the private sector is fairly expensive. So cost is one of the barriers. I think with the Latinx community, a huge barrier is also finding somebody that speaks their language, right? In a recent study that was conducted by the American Psychological Association, only 5% of mental health providers identified as being able to provide services that were bilingual or monolingual to their members. So 5% is a very, very low rate. In the same study, I believe it was over 80% of the providers identified as white, right? So I think another barrier is that distrust for the healthcare system in general, and also not being able to see providers that look like them and speak like them, right? So there's language barriers, and if you really take a look, learning the language when working with Spanish-speaking community is one aspect, but it really doesn't address the cultural aspect, right? And recognizing that the Latino community or the Latinx community is very diverse, right? We have individuals from Mexico, and we have individuals from Cuba, and individuals from Honduras, and we're not just one group, right? So it's really important not only to have somebody that speaks your language, but also takes their time to really respect who you are as an individual and get to know your culture. So language, culture, cost. Sometimes we have this idea that we can take care of ourselves, right? That we can fix this on our own. And I think some of it also comes from our own communities, to be honest with you, right? Sometimes our community tells us that we are not to speak about our problems to outside entities or people, right? So we grow up with that, and we have these feelings of shame or guilt if I'm experiencing emotional and psychological distress. So these are some of the barriers that I've seen that prevent people of color and communities of color from accessing appropriate mental health services effectively.
Okay, I appreciate that, Rojelio. Thank you so much. Now, I'm gonna come over to you, and we'll put a slightly different twist on this. Why don't you talk to us a little bit about how mental health is impacting women of color?
Yeah, thanks, Chidi. So, I mean, overall, mental health issues tend to occur in communities of color at about the same rate as in white America. But what we do know is that when it comes to the African American community, the Latinx population, when they experience mental illness, the episodes that they experience tend to be more severe. They tend to last longer, and they tend to be more debilitating than other racial and ethnic communities. And so people of color are more likely to report psychological distress. And within the African American community, people are 20% more likely to report that distress than white Americans. And so the question is why, right? Like what's contributing to that? And the reality is it's a combination of things, right? The historical and the current experience of people of color in America that include what Rojelio and Melvin have already touched on, right? Trauma, violence, ongoing systemic racism. And all of this directly impacts the mental and emotional health of people of color. And what we also know is that mental illness is actually happening at a higher rate than most other illnesses, right? Like heart disease, diabetes, even cancer. And so that's especially concerning for women of color, because we know that women are at least twice as likely to experience major depression than men. And so, and compared to Caucasian women, women of color are only half as likely to seek out help. And so there are two populations that are kind of dear to my heart. So, you know, it's mothers of color and women who migrate to this country, right? So postpartum depression affects over 11% of women in the US. So that comes out to be about 1 in 9 women. And postpartum depression is more likely to happen for women of color, right? So new mothers of color experience postpartum depression at a rate that's about 2 to 3 times more or higher than all new mothers. And for many new mothers of color, we think of maternal mortality, right? Because the reality is Black, Native American, and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. But we also want to think about, what about the women that do survive, right? So we have to think about the different adverse life experiences there, the financial stressors, the pay inequity between women and men, especially women of color, right? Relational stressors, poverty, single parenting, overt, covert racism, police brutality, right? In regards to women, Black women are more likely to experience police brutality and racial profiling. Incarceration, Black women are incarcerated at a higher rate than they represent in our country. So those are just some of the stressors that women of color deal with on a daily basis, the stressors they bring into their pregnancy, and then this affects maternal health and obviously maternal mental health as well. And then there's also the unique stressors to immigrants, right? Especially Latino immigrants, and majority of immigrants who come into this country are pretty resilient, right? They're the risk takers. They're the ones that are willing to do whatever they can, sacrifice everything for their family. And there is this health paradox that what we know is actually recent immigrants have better mental health than native-born Latino and non-Latino communities. But with time, what we've found is that these gains start to decrease, and they actually become worse than the native born Latino and non-Latino populations. And some of that is acculturation, right, to different cultural norms and standards, but it's also this idea of segmented assimilation, right? So individuals have an opportunity to move upward in our society, others move downward. And then there are those that, because of their circumstances and the conditions that they're in, that they get segmented into certain sectors of our society, right? And so in the case of the female immigrant, that minority status is heightened, right? And there's that political rhetoric around immigration that, you know, women come to this country to have these anchor babies, right? So that they can stay. And so really looking at the level of discrimination, the minority stress, and the trauma, right? It's the pre-migration trauma that's prompted these women to leave their country, the migration trauma, and then also the post-migration trauma that are extremely detrimental to women's health and mental health.
Outstanding, outstanding. Boy, this you guys are killing it. We're gonna keep this going. Let's see, Melvin, I'm coming back over your way. You talked a lot in the beginning about the patient population that you've been working a great deal with, the African American community. Can you talk a little bit about some of the barriers that you've been observing in terms of people from of African American descent seeking treatment?
Yeah, thank you for that. Rojelio and Abha both did a great job of, highlighting a lot of things that I'm going to kind of piggyback off of that. One big barrier I'm seeing with patients that I'm working with is the stigma attached to seeking mental health. I hear a lot of my patients saying, but I'm not crazy. I don't want people to know that think I'm crazy. I don't want my job to find out. That's a big term. So the stigma attached to it, the stigma attached in specifically the African American community or people of color's community is telling things outside of your home, sharing family business. You're a stranger. I'm not going to tell you. What are you going to do with that information? Things of that nature. So I'm noticing a lot of things around stigma, not wanting to be labeled. Or another big thing is one of my passions is being a African American therapist is people not feeling connected. My therapist won't understand. You don't look like me. You won't understand. He doesn't understand where I come from, right? But when they come to me and they sit down, they automatically feel a connection just because I look like them, because I look like their uncle, I look like their brothers, I look like their fathers. So there's automatically a comfort that happens. So that's a big barrier. People not feeling comfortable, not wanting to be stigmatized and not wanting to be labeled, and things of that nature. Rojelio did a good job of talking about access too, not having insurance, not knowing where to seek it. Where do I find help? Where do I go when I feel this way? So in the African American community, we often go to church. We're a very spiritual community historically. So we'll go to church and we'll talk to the pastor, right? And then we'll just keep it there, right? So I've encouraged a lot of my patients to say, okay, yeah, I hear you talk to the pastor, but let's get some evidence-based information behind what you're doing. Let's get some stats behind it, right? So if you could talk to the pastor about what's going on, hey, let's go a little further with it. Let's talk to somebody, let's trust and ask and advocate for yourself. That's another big barrier. Our patients not knowing how to advocate for themselves, believing that they don't have rights, not knowing what their rights are. So some of those barriers that they're experiencing, I think it's on the community and on the healthcare professionals to reach out and educate, right? And provide a outreach to people so that they educate them and break down some of those barriers. So a lot of the onus is put on people to reach out and seek services and seek help and not self-medicate. But I think the bigger responsibilities I put on myself as a healthcare professional to say, I need to educate, I need to reach out, and I need to continue to advocate and be an ally for people that look like me and people that don't, that need mental health services. So that
Thanks,
answered your question.
Melvin. Thanks for that very thorough response. I appreciate that. Now I want to build on this conversation around stigma and overcoming it. And I'm gonna come back your way. Tell us a little bit about how you feel like stigma impacts women of color as it pertains to their mental health.
Yeah, definitely. So yeah, what we know, right, like what we've all been talking about is people of color are reporting more distress, but higher levels of distress doesn't equate to higher levels of treatment, right? So only about 25% of people of color will seek treatment, whereas about 40% of white Americans will. And so we know that social and cultural reasons contribute to this. Historical biases play a part, overall distrust in the medical system, like people are talking about here, right? Unequal or lack of access to healthcare. But stigma, I think, plays a huge part, especially for women of color. I think women of color have been taught to internalize the strong woman persona, right? And for some women, we strive for that label, right? It makes us feel good, it makes us feel worthy. And we don't always acknowledge the unconscious and sometimes conscious, right, undertones of inequality, misogyny that comes with that, the double standards, the unrealistic standards of beauty, almost impossible ability to kind of have this balance between work and home life responsibilities, right? So despite being discriminated against in almost all sectors, employment, education, healthcare, women are encouraged to toughen up and keep going. Right? There's this need to wear all the hats and take care of everyone before themselves. And, you know, I think it's, if I don't do it, who's going to do it? If I don't do it, it's not going to get done. Right? So there's no doubt in the amount of strength in women, but under that veil, there's also, you know, we're left feeling emotionally, physically, mentally exhausted and drained. And so in many communities of color, women are seen as a backbone of families. And so admitting the need for help can be extremely difficult, and it's usually not encouraged, unfortunately. And even some languages, right, especially in the South Asian community, we don't even have a word for depression. And so what happens there, right, for women who are experiencing those types of symptoms, inevitably it's going to be a downplay of those symptoms, right? It becomes I'm just stressed, I'm a little overworked, I'm a little overtired, it's okay, right? I can keep going. And so women of color learn to ignore the signs of mental illness and instead, again, just label them as general stress instead of chronic stress that has been built up and built up. And I think, you know, another thing is that the lack of cultural sensitivity and competency by healthcare providers, right? If I don't necessarily feel like I'm going to be heard or understood, what's going to make me want to reach out for help then, right? If I can't find a provider that looks like me, that knows my culture, what's going to encourage me to reach out? And so all of that is a combination that deters a lot of women of color to seek help.
Thank you, Abha. Appreciate that. So Rojelio, I'm going to come back your way. And so, you know, this question I'm going to ask you is we're going to kind of walk this back a little bit. And we're going to go to that point of the, you know, that pivotal moment where people are wrestling with the decision of whether or not to seek help. So my question to you is, how do I know when it's time to seek professional help around my mental health needs?
Right. Good question. I think the first thing that is important for us to recognize is when we are experiencing a life event that is impactful, we are going to respond emotionally and psychologically accordingly, right? So if my dog were to die, it's expected and normal that I feel some sadness, right? So depending on what's going on, some of the feelings that we're having are extremely normal, right? However, it's important to really pay attention to what's happening and how long it's been happening. And besides feeling sadness, am I recognizing other things that have negatively impacted other aspects of my life, right? So if I'm feeling down and I'm having a difficult time sleeping, I've lost weight, I'm eating in a way that's really unhealthy, I'm isolating, I'm drinking and I'm not identifying as an alcoholic, but I'm drinking more than what I used to drink, right? Or I set limits for myself and then I give myself permission to pass those limits, right? So I'm only going to drink on the weekends. And then, I give myself permission to drink on a Tuesday, right? Or I'm only going to, drink 2 before I leave, right? And I drink 4, right? So now, not only am I drinking maybe to ease some of my concerns or what I'm experiencing, but I'm setting my own limit and then I'm surpassing it, right? Because mental health, we have this idea that mental health is only emotional and psychological distress, and drinking or maybe using drugs is a moral failure or it's something that you're doing wrong, right? But we also have to recognize, and we do have a department of addiction medicine here at Kaiser Permanente to assist those members that are also struggling with substance abuse or alcoholism, right? So if it's really difficult for me to identify what I'm experiencing, it's also not uncommon for us to have family members to point certain things out, right? Sometimes they'll notice that you seem a little bit more detached, or sometimes they'll notice that you're a little bit more irritable, right? Or disconnected, or you're sleeping a lot, or you're not sleeping at all. So it's really important not only to pay attention to what's happening with me and my sleep, my appetite, etc., but also paying attention to those family members that love us that are pointing out, I've noticed these changes in you, right? So it's really important to just normalize that we are going to have reactions to the injustices that we've talked about today. It's really important to feel angry and recognize I'm angry at what I'm seeing, what I'm hearing, right? The rhetoric that was coming from some of these institutions, like it's okay to feel that. However, once it starts to impact other aspects of my life, right? Other aspects of my health, right? Then it's maybe important to say, I'm going to go seek that professional health and talk to a mental health professional or provider.
Outstanding, outstanding. Thank you so much for that. Okay, so this next question, Melvin, I'm going to throw this one at you, but Rojelio and Abha, I'm curious about your opinions on this as well. So I'd like you to be thinking about your thoughts on this after Melvin responds. But, Rojelio just did an excellent job of just kind of highlighting a few markers in terms of, situations or behaviors, experiences that could potentially point someone in the direction of recognizing their need to seek out mental health. Now, to kind of take this up a level, I'm curious what your thoughts on it. And Melvin, I'm coming to you first. As people are struggling with, for people of color, I think this is a reality that we carry, on a day in, day out basis as it pertains to struggling with issues around racism, struggling with issues around discrimination, violence in the community, immigration-related issues. So as these things that we, for many of us, because we experience it so often, it just becomes a part of our day-to-day. The question then becomes is at what point do you go, okay, how this has affected me is now starting to impact my mental health. So the question is, what are ways a person can lean into mental wellness when they may be struggling around racism, issues around racism, discrimination, violence, or immigration-related issues?
Thank you for that. Thank you for that, Chidi. I believe ways that persons can lean into mental health wellness, that they've been struggling with racism. You mentioned discrimination, violence, and immigration related issues is seeking. There's a lot of help out in the community. A lot of people are seeking funding right now. It's a big thing that funders, the philanthropists are funding. A lot of community activities, a lot of mental health is the big thing right now. Mindfulness. You see the apps on every commercials. You see lots of awareness is being placed on racism and the causes and effects on the community with mental health and physical health. So educating ourselves, right? Outreach. I think it's imperative upon. I keep reaching back to myself, and I'm leaning into my colleagues here. Is us educating individuals in the community and letting them know it's okay to reach out for help, right? Letting them know things that they've normalized, drinking, which is prevalent in the African American and people of color community, drinking, drug abuse, suicide, infant mortality. There's a connection to all these things. And people don't know this. They don't understand that. I was reading a book called The Body Keeps Score. I've been researching that now. And it talks about the trauma that we continue to store in our bodies comes out in diabetes and all the different negative effects that we're having health wise. It's because we've normalized trauma, right? So getting people to speak to their doctors and understand why you're having these migraines and these headaches, why are you having the miscarriages, why you continue to be angry, why you can't concentrate, why you're being medicated for ADHD. Our young boys and young girls in these schools are being over medicated for ADHD. And it's caused, we aren't leaning into what you talked about there, Chidi, mental health and seeking out the resources we have in our community. I would say also a lot of our people are influenced by celebrities. Right, so that's a big thing. You see a lot of celebrities right now that have leaned into mental health. One I'll speak to, and I'll be brief here, is a gentleman by the name of Charlemagne the God, who's a big personality on the New York radio. He's wrote a book, right, about mental health. So you're seeing rappers, you're seeing Jay-Z, you're seeing a lot of celebrities, athletes are leaning into mental health. So look at the people that we look up to who often aren't mental health professionals and mimicking some of their behaviors and understand, hey, if that works for them, maybe this could work for me. So just look at the people that we trust and trying to make those connections and understanding that we need connections. And part of our reason for not seeking out connections and not wanting to trust people is because the traumas that we've normalized, right? So I would say lean into that and kind of, be a little bit more open to assistance where we weren't in the past because we were afraid and, things of that nature. So.
Thank you, Melvin. Let's see, Rojelio, I'll throw this same question over to you.
Yeah, so I think one of the things is that unfortunately for communities of color, oftentimes we're pushed into mental health. So it's kind of like a punishment, right? If you think of if I were to get a DUI, I have to go to counseling, I have to go to 12-step, right? So I really appreciate the word lean into mental health because oftentimes communities of color are pushed into mental health and mental health is then seen as a punishment, right? I have to go to parenting classes, right? The judge is making me do this, right? And one of the things that I try to do is try to reframe that to some of the patients that I work with. I say, no, you get the opportunity to go to 12-step meetings. Some of those individuals that struggle with substance abuse and chemical dependency don't have that opportunity anymore because they've succumbed to their illness, right? So leaning into mental health is how do I move forward so I can get the treatment. And part of it is just recognizing that mental health counseling and services are not punishments. There are enhancements, to what you're dealing with. These are approaches that, like Melvin said earlier, are evidence-based approaches to help you with those challenges that you are experiencing. And I think the onus is on us as mental health professionals, having these types of panel discussions and dialogues, looking for people that look like you that are talking about their mental health, right? Athletes, TV persona, right? It's interesting, as a mental health professional, sometimes I'm listening to ESPN and I'll hear certain words and I'm like, oh, this guy looks like he's in the 12-step program, right? But a lot of us don't know that because we're so afraid to step into mental health. We're so afraid that somebody's gonna, film us walking into a mental health clinic, or that as soon as Rojelio walks into this clinic, lights and sirens are gonna go on and everybody's gonna turn and stare at him, right? So there's a lot of fear that has been, instilled in communities of color by systems, right? Like I mentioned earlier, being forced into mental health like a type of punishment. So then that's going to have us say, I don't really want that because the last time I went, it's because I had to go, or else then I'd have a more severe punishment. So just, Melvin talked about like speaking to spiritual leaders, right? Speaking to, in the Latinx community, I think another important thing is having conversations with the elderly, right? Because my interpretation and my perception of mental health is very different than that of my parents, right? My parents are immigrants from Jalisco, and they didn't speak outside of the house unless it was somebody from the church, right? So having that dialogue within our families is also extremely beneficial, right? When I was studying to become a mental health professional, my parents were, I think Melvin mentioned it earlier, my parents mentioned the word crazy. So are you going to be working with crazy people all the time, right? And it was my responsibility to educate my parents about my career and my choice and the benefits of mental health, right? Knowing that, my parents as immigrants, the traumas that they've endured, and haven't really had an outlet to have these conversations, right? So I think it's just a lot of dialogue, and I really appreciate, like Melvin said, the commercials for calm and mindfulness, the folks in the media that are talking about mental health and the importance of taking care of our mental well-being, but also recognizing that unfortunately, oftentimes it's been used as a punishment. And when we are punished with something, we are resistant to that also, right? So if it's consistently used as a punishment, I think it's going to continuously have us kind of shy away from it, because that's what quote unquote people do when they get in trouble, right? As opposed to that's what you do when you're experiencing emotional and psychological distress, right?
Thank you, Rojelio. I appreciate that. Abha, what are your thoughts?
Yeah, I mean, I completely agree with Rojelio and Melvin. I think it's a combination of education and normalizing, right? And also I think broadening the understanding of some of these terminologies, right? Like what mental wellness, like what does that really mean, right? Like for us as providers, maybe we have some sense of that, but like the community, I don't know what that means, right? I don't do yoga. I don't meditate. So that must not be for me, right? So I think helping people to understand really what does mental health, what does mental wellness, what does that actually mean? What does that look like for me versus my neighbor versus my sister versus whoever, right? And the different components that are involved in it, right? That mental component, how are we thinking, how are we processing, how are we understanding and utilizing the information that we're taking in from our society, from our community, from our family, right? Emotionally, how are we feeling, right? A lot of us grow up in families that I don't know. I don't know how I'm feeling, right? Like we don't talk about emotions. What is that? Or maybe I know mad and I know happy, right? And I know sad, and that's about it, right? So just starting there, like let's normalize emotions, right? Let's take away the stigma of emotions. They're not good, they're not bad, they are what they are. We all have them. There's a function, there's a purpose for them, right? So I need to learn what is it that I'm experiencing in order for other people to know what I'm experiencing, right? And I need to learn how to manage that. But if I don't even know what I'm experiencing, how am I going to know how to manage that? Right? The social component of mental wellness, right? How are we connecting our relationships with ourselves, with others, and the psychological component, right? How do we act or function? How are we putting pieces together? How are we taking external inputs, internal inputs? Like, how do we make sense of all of this? So I think dialogue and what we're honestly doing right now, right? Like speaking to it and allowing these conversations to happen, I think is so important and so vital.
Excellent, excellent. You know what? You all have truly given us you've said a mouthful and you've given us tons of great ideas to think about this morning. I'm going to throw one last question out at the three of you, and we'll do another round robin like what we just did, just because it worked so well. um, let's see. I want to hear from each of you. I'd just like to get a few ideas from you, just to for the folks listening in today. What are some strategies that people can employ just to take care of themselves as it pertains to their mental health? Well, let's start off with Rojelio this time.
Thank you. Thank you. So the first thing is to check your own willingness, right? What am I willing to do right now to take care of myself? Oftentimes, we can Google strategies, right? I can Google what can I do to take care of my mental health, and it'll say take a walk. If I'm not willing to take a walk, then that strategy is not going to be benefit to me, right? So I think what's important is, okay, what am I willing to do right now, and start there first, right? One of the things that I encourage some of the members that I work with is to dedicate 1% of their day to themselves, right? And I even tell my members, you don't even have to do the math because I've done it for you, right? So that amounts to 14 minutes and 40 seconds, right? I want to know if you are willing to dedicate 1% of your day to yourself every day. And more often than not, because they hear 1%, they are willing to do that, right? So then we talk about strategies that they can employ for those 14 minutes and 40 seconds, right? We talk about journal writing. We talk about meditation. We talk about walking. We talk about, being mindful when you are listening to your favorite artist and music, right? We talk about providing a hug to somebody that you love and counting down for 5 seconds, right? We talk about deep breathing exercises. So it's really important to recognize that we are not just one thing, right? I'm spiritual, I'm emotional, I'm intellectual. So what are some of those things that bring me joy? And how do I begin to implement those as an everyday part of my life? Because I am the most important person in my life, right? And I think that's something that we've got to remind ourselves. We have children, we have spouses, we have partners, we have employers, we have parents. They all benefit from the healthiest Rojelio possible, right? So putting myself first and having everybody a really close second, right? And I think that's another challenge that we have, because we've also been taught and told that if we put ourselves first, we're selfish, right? So it's really important to just recognize that putting ourselves first does not mean discarding the people that we love. It means taking care of ourselves so that people that we love benefit from who we are truly. So starting off small and then reaping those benefits. And if we can build to 1.5% or 2%, great. But first, checking willingness and starting small, I think, is a really helpful strategy.
Thank you, Rojelio. Okay, Melvin, I'm gonna come over your way.
I would say start small. I mean, good job, really. I would say start small. When I talk to my patients about making change, because change is hard, right? Change is hard for people. Doing something you've seen people do all their lives, things that have been normalized, and you're gonna do something different. That's hard. So I say keep it simple. Just keep it simple and ask yourself, what's going on? Right? Sit still and observe. Right? I'm drinking too much. I'm getting into arguments. Think people on the job are saying things about me. I'm being nervous when I see police. My wife, I'm arguing a little bit more. My kids are acting out a little bit more. I asked them to ask themselves, sit back and observe, and then ask themselves, why? I tell them that 3-letter word is very powerful. WHY. Why is this happening? All right, sit down and just jot it down. Why is this happening? Oh, I got into a fight. Or why is this happening? My wife says this keeps happening. Or my parents have said this. Or I grew up this way. So sit still and observe and ask yourself why. And once you come up with a few things, you don't always have to put the pressure on yourself to have the right answer. But I say once you jot down a few ideas and you have some kind of parameters to go with, some kind of examples to go with, now ask yourself, not good or bad, because people say that. I heard Abba was talking about that too. People look at stigmas and things. This is bad. This is good. Look at it in terms of what's healthy and what's unhealthy, right? And you could relate to that, because this is, you know, things that make me feel good, things that don't make me feel good, things that doctors are telling me about my blood pressure, you know, things my wife is telling me, things that cause an argument when I go to her, things that, you know, cause a disagreement on the job. Is this healthy? Is this unhealthy? So assess it through those things and take the judgment off yourself and look at it there. Then ask yourself, what do I want to change? All right. Now, once you label it, you could talk about what you want to change and then take steps using your five senses, you know, what you hear, what you smell, what you taste, what you touch, and what you see. Use those senses and run those ideas that you've come up with, run those reasons through those senses and see what you come back to. So I would, you know, encourage people to just sit still and pay attention. I often tell my patients, we take care of our cars. When that check engine light comes on our car, we'll take it to the shop. But when the check engine light comes on our emotions and ourselves, we often don't go to the shop. Seeking mental health and speaking to somebody about your mental health is possibly your check engine light coming on. So I say, go, you know, I encourage them to go see somebody about it. All right.
All right. All right, Abha, bring us home.
Yeah, I think a couple of things came to my mind. You know, the first thing was the word connection, because I feel like when we are really struggling, we disconnect, right? We disconnect from ourselves, we disconnect from the people in our lives, we disconnect from everything. And so where can I connect again? Maybe it's too scary to connect to myself right now. Maybe it's too scary to connect to my friends or my family right now. But is there something? Is it going outside and connecting with nature? Is connecting to my pet right now? Because that's what I can do. Right. But I think instilling that sense of connection is so important for us as human beings. And again, it can be really scary, but can we look at it differently? Right. Can we look at the different areas in my life where I have disconnected, and maybe this area feels a little bit easier to me. I also think, going along with Rojelio and Melvin, right, like creating that change, and it's hard, but also recognize what I am already doing that brings me some level of joy, right? It might not be tenfold, but some level, right? And I believe that we all have those moments. Whether or not we put attention on them, that's different, right? And so now we're asking ourselves to put attention on those things. Is it my morning routine? Is it my night routine? Is it, you know, the middle of the day when I get to take my dog for the walk, or play with my children and not worry about the dishes or the this or the that? And let me acknowledge those, right? Because when we're stuck in our distress, those things, those experiences, they disappear, right? And we focus on the things that are all going wrong. And so I think taking time to acknowledge what is going right, even if it's small, is so important.
Beautiful, beautiful. So we've heard from Abha, we've heard from Rojelio and Melvin, all of which, as you can see, excellent clinicians, doing great work in the community and really representing the profession in a tremendous way. I want to thank you all for participating this morning. And I know we're getting close on time, so without further ado, I'm going to go ahead and pass it back over to Danielle.
Thank you so much, Chidi. And I, just like Chidi, want to say a major thank you to Melvin, Abha, Rojelio, and of course you, Chidi. These were really great insightful questions and answers. I even took some of it away, like, dang, Danielle, this is your third latte today. Like, let me check in with myself to see what's going on, girl. So I really appreciate that. If anybody on here, whether you're listening on the phone, I hope it sounded like a really fun podcast. Whether you're listening to this on the replay world, you're like, this is a great YouTube video. That's our hope. So all of us here at Kaiser Permanente, we want to thank our amazing staff who came on and really shared their wealth of knowledge, really made it feel warm and welcoming. Because honestly, you guys are amazing mental wellness and health experts that I would kind of be like, hey, friend, you need to check out Melvin. You guys need to check out Rojelio. Abha, she's awesome, you know? So thank you so much for that. But even more, thank you to everyone who showed up and came just to listen and get some information that I hope is helpful for you all. So with that, we've got like just a few minutes before we close this out, but I did want to send this back to you, Monica, and also say thank you so much to you for making the tech world of this all come together and happen for us today. So thank you always, Monica, and Colin, who's not with us, with the Culver City Chamber of Commerce.
Yes, thank you all for this amazing conversation. I know I gained from it, although I've known some of these, ideas, being myself a minority and confronting some of these issues in my own life, but it was an amazing conversation, and I hope for everyone that's listening that took away a lot from it as well. As always, the replays are going to be available, the one from last week and the one from this week. We have them on our website, and I'll be also sending out communications. And we have 2 more from this series coming up. It's every Thursday at the same time at 12. And the next 2 topics are for May 20th, it's helping parents and children manage stress from the pandemic. And on May 27th, it's mental well-being and social connectedness in the workplace. So we hope to see you at upcoming series events.
Thank you so much for having us. Thank you.
Thank you. Thank you.
Yeah.
Thank you very much. Thank you. Thank you.